We'll do one more introduction. So good morning, everyone. My name is Cindy de la Torre. I'm the events manager here at Denver Scholarship Foundation. We'd like to welcome everyone to our mental health virtual insight panel. And I'm going to pass it on over to my colleague, Sarah, who's going to be our moderator for the day.
Perfect. Thank you so much, Cindy. Hi, everyone. It's so nice to see you all on this morning. My name is Sarah Goldich, and I am the Corporate Relations and Volunteer Manager at Denver Scholarship Foundation. So I have the pleasure of working with many different companies and organizations that support the organization as well. And we are excited to have 3 different panelists here, all within similar field of mental health and behavioral health, but representing different hospital and health systems and all with unique backgrounds. So we are just going to jump right in. We're really going to spend most of the time today hearing from our panelists. As Cindy mentioned, please drop questions in the chat throughout. But I am going to just jump right in and start us off by having the 3 of you just do a brief introduction, your name, what company you work at, maybe your title, and then after that, I'll jump into more in-depth questions to hear more about your journey and your background and how you got to where you are today. So if we want to go right now, Audrey, Kellie, and then Miranda, I will let you all unmute and share a little about yourself.
Wonderful. Well, thank you so much for having me. I'm Audrey Hinshaw. I am the manager of operations for UCHealth's behavioral health service line. That means I do a lot of very different things, but a lot of education, a lot of regulatory work, a lot of quality work, and a lot of performance improvement and safety for our patients and our staff. So my background, I actually grew up in Wisconsin. Went to UW, got my undergraduate degree there, and then moved out here for my MBA, so my master's in business administration. Got stuck here with COVID when that shut everything down, and then stuck around. I worked at an inpatient psychiatric facility here in Colorado for several years, and then transitioned to UCHealth roughly 3 years ago. And since joining UCHealth, I have started my master's in social work. So I am working on that, and I will be graduating next May, which I'm very excited about. So happy to talk about any and all of that as we go through today.
Hi, my name is Kellie Brown. I am one of the therapists at Kaiser Permanente. I primarily work on the crisis team there, and I've been there for about 9 years. A little bit about my background, like Audrey, I am also a transient, so I moved here to Colorado, but I started in Ohio. So I'm from Ohio, the Midwest, and I did undergraduate school at Ohio University. And then I didn't know what I wanted to do after undergrad, so I applied for graduate school, and that took me to Chicago, where I got my master's in forensic psychology at the Chicago School of Professional Psychology. My first job was working in jails. So I have background of working with inmates. And then from there, I moved to Colorado and worked with community mental health, individuals with severe and persistent mental illness. And then back to the jails I went. And now I'm working with the crisis team here at Kaiser. So lots of different backgrounds there. And happy to be here with you guys.
Good morning, everyone. Thank you for having me as part of this panel. My name is Miranda Stewart. I am an adolescent therapist at the Medical Center of Aurora. It's our behavioral health and wellness hospital. So it's a psychiatric hospital. I'm currently, like I said, working on the adolescent unit. I have a background in social work. In order to be where I am now, I have my undergraduate degree from a private university in Texas. So like the rest, also from out of state. But I came to Denver area about 2 or 3 years ago to get my master's of social work from the University of Denver. And I've been working as an adolescent therapist since then. I'm happy to be here. I'm happy to be part of this panel.
Awesome. Thank you all so much. That's such great introduction and background. And since those of you already shared a little bit about, kind of some of the steps you took to get to where you are today, I'd love to just ask the question, how you chose to take that path, if you don't mind. If there's anything else along your journey you would like to share, but really, how did you decide on the pathway that you took and the career field you're in right now? And we'll go in the same order if that's okay.
Sure. I was like, I'm not sure if it's me or what. I started out actually wanting to be a doctor. I started studying for the MCAT, which is that initial exam you need to get into medical school. Decided that maybe that wasn't for me when we started to kind of do some I did some nursing experience. I did not enjoy blood. So that very quickly said that is not the right path for me, but I still wanted to be involved in healthcare. And so I interned at a private practice on the administrative side and really saw how that kind of world impacted the care that our clinicians and our staff were able to provide. And from there, what I ended up doing was deciding I wanted to get that master's in business with a focus in healthcare to help kind of run the hospital from that standpoint and run the services that are impacting patients at kind of a larger scale from there. So I came out, did the MBA, was literally just looking for a job of some kind in healthcare to use my degree once I graduated with it, because it was COVID and there was not a whole lot of hiring going on in a lot of places. So ended up kind of by accident at an inpatient psychiatric facility and really found my passion for that patient care and all of that, and how it impacts mental health and how mental health impacts all of the rest of how we function as humans, and how it is interrelated with all of healthcare. And so from there, I actually ended up being recommended for a role here at UCHealth from my job at this other location. And when I arrived here, there was a lot of encouragement of continuing to develop your education and your skill set. And so UCHealth is a really cool program around paying for advanced education. So I decided to go get my master's in social work so that I was better prepared to help with from a clinical standpoint, from an operations standpoint of ensuring that we were providing really good quality care for our patients. So that is I kind of dropped into this field, but I am very glad that I did.
I will say my journey here was unexpected. In starting college, I had no idea what I was going to major in. I was like, I'm first generation going to college. I'm like, great, I'm going to go. And once I got there, I really just took courses that I thought was of interest and ended up really taking to sociology as well as psychology. So my major is actually sociology, minor in psychology, and I really like just learning more about the behaviors of people. Growing up in a single parent home, I was really interested in kind of how people end up where they are. So like the study of behavior, background, all of that. And so that was kind of why I landed in that major. And then honestly, I was not expecting to go to grad school. I have a twin sister who knew what she wanted to do. So her path was clear. And at the end of college, she was applying to graduate programs. And I was like, well, I guess I'll apply to graduate programs. And ultimately, that's what led to me going to the program in Chicago in studying forensic psychology, which I really enjoyed. I really like that population. So when I did get my first job at Cook County Jail, which again is one of the biggest jails in Chicago, it really was kind of hitting the ground running, and really enjoyed that population, that exposure to just everything. So I thought for sure I would remain in kind of that system throughout my career, but never say never. When I moved here to Denver, I was really just kind of applying for anything at that point, really trying to figure out kind of where I wanted to go next. That landed me in community mental health and working with the intensive treatment program, where I was exposed to working with adults with severe and persistent mental illness, which I really enjoyed as well. So most of those patients that I was working with were certified, so they had to engage in treatment. And it was really a population I was unfamiliar with, but really enjoyed working with. When I had the opportunity presented within community mental health to return to the jails, I took that. And so the my position there looked a little different than previously, where I was actually providing more therapeutic support than assessments. After feeling burnt out from that, after I want to say 3 years at the jail, I just started to look for new positions, in which I landed at Kaiser as a crisis therapist, and have found that I really enjoy that as well. I'm exposed to a wide range of individuals, so populations from children to geriatrics, and really just continue to grow every day within this position. So I've been there for 9 years, and I really enjoy it for right now, but I don't know what might be next.
Kind of reflecting back on my journey, I would say that kind of like Kellie was mentioning, as well as Audrey, it was a little bit unexpected that I ended up where I am now. During my years in high school, I faced a lot of challenges that really didn't make it seem like higher education was going to be possible for me. I was homeless several times throughout high school, and one of the things that I noticed as I kind of looked around myself was that the people that I trusted most in my life were social workers, just different people that were part of like my church community that I was really a part of growing up, as well as just different parents that were kind of involved in my life in different ways. And so that was something that I felt like might be important to me, or might be interesting to me, just kind of based on that personal experience. I was also a part of a program that's kind of like this, as far as I understand. But at my high school, we had the ability to sign up for an elective course that allowed us to have some guidance in applying to schools, applying for FAFSA, scholarships, all of those things. So I definitely received a lot of support on the front end. Like others have said, being a first-generation college student, I didn't really have a lot of people, in my life and my family that I could maybe ask for support or ask for help from, just with those processes of applying to school and kind of figuring out what is it that I want to do. And so when I finally made the decision to pursue my undergraduate degree, like I said, it was at a pretty small private school in Texas. Some things that were important to me at that time was immediately getting plugged in as like a student worker, just kind of learning the campus and learning just different supports that were available to me. I did end up taking a leave of absence from school during undergrad, really just to kind of focus on my health and be sure that the track that I was on was the track that I wanted to stay on. So that was also something that was not necessarily expected for me in terms of my education. Once I graduated from my undergraduate program, I had studied social work. It had become important to me to work as part of some sort of interdisciplinary team. I think the more that I learned about that in my program, I wanted to be trusted as the voice of my discipline on a team of different disciplines. So I knew that I wanted to work with either a team of like lawyers or doctors, or just people who had different education from me, who thought differently from me, who had different perspectives. So my first job after my undergraduate studies was at a medical hospital. And I worked there for about 2 years before I decided to make the move to Colorado to pursue my graduate degree. Kind of similar to others as well, when I first moved out here, I didn't expect to enroll in a program right away. We actually moved here so that my wife could start a master's program. And the timing just kind of seemed right as far as me being able to start school at the same time as well. So I had 1 year that I was also in school with my wife, and that was a lot of fun. It was great. At the University of Denver, I kind of stumbled upon a specific, like, specialized vocational program that ended up being really helpful to me. It was a stipend program that I was qualified for, and it was basically all that I was looking for. So it was working as part of like an interdisciplinary team. It was students who were specifically interested in joining some sort of team that was working in some sort of behavioral healthcare setting. So that was also an important part of my journey, was just being able to have that stipend that I could rely on and devote more time to my studies and to my internship, as opposed to like having to work another part-time job during school.
Amazing. Thank you all for sharing a bit more into, I guess, the thought process and everything that took place to take you along your journeys. So before we jump into some questions that were submitted by their students and scholars, I would love to hear from each of you more about what your day-to-day or week-to-week job looks like, to get a better, idea of, maybe some similarities between the three of you, some differences in terms of your actual, everyday life at work. So are we okay going in the same order again? Do we want to mix it up? Okay. Audrey, are you okay going first? I don't want to put all the pressure on you every time. Okay.
No, that's fine. If nothing else, I'll keep talking till I get to the point. So one of the things, I think my day-to-day is probably slightly different in that I'm not working as a therapist. It's myself. I work with a lot of therapists. I work at sort of a larger scale. So my role is system-wide, meaning I am involved in things happening in all of our programs. So we have programs that are inpatient, outpatient, residential, focused on substance use, focused on mental health. We've got staff in the emergency departments. We have, I supervise a co-response team. So a clinician goes out with an officer or an EMT in the community and responds to calls in the community. We have, our clinicians who are integrated into our primary care practices. So lots and lots of different people who I'm working with on any given day. So my day is potentially a lot less interesting than some of the other ones. It's a lot more meeting focused. I spend a lot of time collaborating on various projects. So I do a lot of research. I spend time on advocacy boards for the state. So I go to a lot of those meetings. I spend a lot of time with our leaders and with our clinicians. So I shadow them. I get a sense, of what their pain points might be. So where are they, finding barriers to them being able to provide really good, high quality care for our patients. And then I connect all of the right people and get a project going, and kind of identify ways to better provide that care, as that we may not be collaborating on already. So it's a lot of sort of cross-departmental collaboration. It's a lot of supporting our staff. So we have, a lot of times we have some pretty serious instances happen, both with our staff and with our patients. And so going to those locations and supporting our staff is a big piece of my job as well. But yeah, the day-to-day is potentially, I think it's fascinating. I love sort of the macro level view of how we impact all of our patients across the system. But I don't have as much, direct patient-facing care unless I am touring one of our facilities or visiting it for whatever reason. I attend all of our regulatory surveys. So if we have someone from the state or Joint Commission or Medicare, Medicaid show up and want to look at how we're providing care, I go there and I help that. We call them surveyors. I help that surveyor kind of walk through how we provide care, all of our different practices associated with making sure that they're safe, that we're getting all of the appropriate information, that they're on the right medications, etc. So that is also a big piece of my role. And then I do a lot of work I have an educator who reports up under me, and she and I do a lot of work developing education to better train our staff and support our patients in moments of crisis, and making sure that our staff feel that they are comfortable, competent, and ready to go at any given moment, regardless of what may be coming. So that is mine. Like I said, it's not as clinical necessarily, but I like the kind of larger scale impact, and that's been kind of where I fell into, like the other two said. So.
Okay, so like I mentioned before, I am a crisis clinician. So that looks a little different. I don't carry a caseload, so I don't see the same patients over and over. I am really part of a team that provides immediate support to Kaiser members as well as Kaiser therapists or providers within the whole system. The majority, essentially I'm going to provide support to any range of individuals that identify themselves in crisis. So this can, that threshold is pretty range. It can be members calling in experiencing safety concerns. So that can be anywhere from suicidal thoughts to non-suicide self-harming behaviors to just experiencing a panic attack and needing support and working through that panic attack so that they may be able to resume functioning, whether that's being able to go to school or being able to return to work. So really my role day to day is to provide that immediate support to our members. That can look like phone support, that can look like members presenting to any one of our outpatient clinics and requesting to be seen. That can be a member who is meeting with a therapist, and that therapist feels like they need additional support and or further assessment for a higher level of care. So that can be, assessing for inpatient placement, or that can be assessing for, an IOP program or a PHP program. So really providing support to the member to assure that all their needs are met. It could be connecting them to an outpatient therapist, psychiatry. So really utilizing all of those resources within our network to support the patient. So that's kind of the patient-facing piece of my role. Additionally, at Kaiser, it's collaborative care. And so I'm also providing support to our medical team. So the doctors, the nurses that are calling with patients that are in crisis, maybe in their clinic and or their exam room, or newly diagnosed depression, and they're wondering how to connect the members with the appropriate support to therapy. So really, again, my day-to-day looks different every day, and that's kind of what I love about what I do. It's very collaborative within the Kaiser network, as well as connecting with all of our network affiliates, as well as really member facing. So kind of working within a lot of different networks of supporting our members.
Something that was important to me in choosing a job was finding a place that would look different on a day-to-day basis. I think I'm a type of person who needs a quick workplace and needs things to be looking pretty new, looking pretty different, just on like I said, a day-to-day basis. So that's one of the things I really enjoy about my job. So working inpatient, inpatient is in psychiatric care, the highest level of care, meaning that we are focused on, maintaining safety. So patients who are admitted to our unit oftentimes are experiencing some sort of mental health crisis, whether that is, having trouble with keeping themselves safe from things like suicide or self-harm, potentially having, some sort of violence risk against other people, wanting to hurt others. Those are all things that I see like on a pretty consistent basis. So my day usually starts off with our treatment team meeting. That's when I'm meeting with different people on our team, our psychiatrist, nurse, our registered dietitian. I did see in the chat somebody asked about art therapists. We do have a staff of recreational therapists who work here. Some of them use like art or music as like some group interventions. I can definitely talk more about. But during this treatment team meeting, it's basically anybody who is involved in this patient's care for that day or while they're at the hospital. We're meeting together to kind of just discuss patients, understand what their needs are, and be able to make some sort of plan for what things can look like for them moving forward or what our goals for them are. After that, I have a couple of psychotherapy groups that I run. So I run group therapy twice a day. And I also have a caseload of patients that I will keep with me. So I have the same adolescent patients that I'll meet with like on a day-to-day basis while they're here admitted in the hospital. Sometimes just depending on the need of other units. Our psychiatric hospital also houses an adult unit, or several adult units and several geriatric units. So I might be asked to kind of float to those units, maybe meet with some patients. Other things that take place during my week, I'm currently receiving supervision for my clinical license. So in the field of social work, you have the opportunity to pursue different types of licensure. I'm currently working on my clinical license, and there are a certain amount of hours that you need to have with a supervisor, as well as like a certain amount of hours that you have to have worked in order to receive that license. Like other professions, you also have like an exam that you will have to take before being able to receive that license as well. So I'm not quite to that point in my licensure process, but probably within the next year, I'll take a licensing exam for that. I'm also a part of a committee at work that really looks at different incidences of emergency response to any sort of like mental health crisis that is experienced here in the hospital. So just kind of understanding what that process looked like, being able to kind of debrief with other team members and just to make sure that we're all on the same page as far as what some of those interventions can look like. Yeah, I would say mostly that's what my week looks like. Again, it's really different just kind of depending on the patients that we have here, what some of their needs are, but on a pretty consistent basis, that's what it looks like.
That's great. Thank you so much. And since you touched on one of the questions that was in the chat, I just want to pause and see if anyone else has any experience working with art therapists or knowledge at all about, what that may look like. If not, that's okay too, but I just wanted to, since we brought it up, just to pause and see if there's anything else that anyone wanted to add regarding that side of therapy.
From a regulatory standpoint, we are required to have art rec music therapists on our staff for our inpatients. And so we do have them on staff for our purposes. They run groups on the unit. They are a separate sort of designation than our clinical therapists or our clinical social workers, clinical counselors. Those terms are all pretty synonymous on the inpatient setting, at least at our facility. But we do have them in our inpatient facilities, and they actually have a couple of them on the acute side as well, especially in like children's hospitals and things like that.
Yeah, and I personally do not have experience in art therapy, but I can say several of our pediatric therapists are trained in art therapy and will utilize that in conjunction with other therapeutic interventions in supporting our patients. You're on mute, Sarah.
Thank you. I knew that would happen at least once. I appreciate that. Well, thank you all for your additional insight. And as you see, there's another question in the chat and a question that we've received a few times prior to today that I'd love for to hear each of you share a little bit about. And that really is about how are you, prioritizing taking care of your own mental health, in an ideal world to prevent any type of burnout, but would love to hear from each of you just any techniques or what that really looks like within your departments or health systems.
Am I going in the same order again?
If you're ready.
Yeah, that's fine. I talk about it all day long because this is another thing that rolls up under my purview is how we support our staff, because there is a very high level of burnout in healthcare in general, but especially in behavioral health. There's a lot of what we call secondary trauma. So hearing about the things people are going through is also very traumatic. And so we want to make sure that we're supporting our staff as best as possible. So a lot of large systems have internal support systems, whether that be through an employee like health benefit or otherwise. We have something called First Call, which is sort of an on-demand resource for any of our staff across the system who experience something that they just want like 30 minutes to debrief, to talk about with a clinician. So we actually hire therapists and counselors to sit there and wait for our staff to need them. So that is a big piece. We also have something called a peer support program that we are expanding. So basically that partners different team members within the healthcare system with each other who have, maybe different settings, different experiences, to be a resource for them if they're having a bad day, if they need help with something, if they're confused. And so we really do try to prioritize our staff's health and safety as well, because that is a big issue in healthcare as sort of an industry, and is something that's become very apparent in recent years. So from my standpoint, I'm again much more kind of high level. So I am supporting our staff who are potentially, in the process of burning out from secondary trauma and workload. There will never be enough clinicians and inpatient facilities and such to treat all of the patients in our community who need help. And that can also be a very frustrating thing to see every day, and to know that there are more people out there that we could be helping, but we just don't have the time. And so definitely something we're very focused on. I'm interested to hear from both Miranda and Kellie on what their kind of experience is as clinicians themselves. But yes, it is very much a focus from at least the kind of higher level as well, of how do we support our teams and keep them from burning out to that extent as much as possible. Because yes, it can be a very high burnout industry if we don't protect ourselves first.
Yeah, so I think for me, this is twofold. One, I think coming into this field, I really had to do my own work in creating boundaries. So healthy boundaries within the work environment. So knowing what my limitations were, knowing how to say no to additional hours or needs that I knew I couldn't fulfill. And that took a while for me to be able to find my voice and confidence in creating that healthy boundary at work. So, I think that's kind of the first part of creating that, preventing that burnout, is creating that healthy boundary. In addition to that, it really is figuring out what your care looks like. So for me, it's outside of work, what I'm doing to take care of myself, right? So engaging in healthy activities, going to the gym, getting outside, talking to friends, right? So not isolating. When I do have difficult days, because again, I'm working with high acuity patients all the time. So I'm constantly being exposed to their traumas or triggers in all of this, and giving everything I can in the 8 hours of my workday to other people. And so often if there is a very difficult call, a challenging call, one that just drains me and or one that really gets to me, right? Like emotionally. I work with a great team that we're able to kind of debrief in the moment. And I'll often say, who has a moment to talk about this? So really being able to talk about what your experience was, being okay with how you're feeling after a call, and kind of embracing that feeling, but also letting it go. Again, part of what I really like about my position is that I don't carry a caseload. So often at the end of my shift, I'm leaving and I don't often take work home with me. I really try to make sure I'm leaving work at home to then be able to get home to my family to give them, me. And so it really, again, comes to creating those healthy boundaries with work and being able to separate that from kind of your personal life. And that's not an easy thing to navigate by any means.
Yeah, I think a lot of my self-care kind of looks like what Kellie was just saying as far as understanding what my personal limits are in the workspace. And so, if I am asked to help out in another unit, being able to truthfully ask myself, is that something I have the capacity for today? And is that something that I can truly offer in a way that is going to not only take care of myself and the needs that I might have in the workplace today, but also just being able to, be honest with myself so that I could provide quality care to the patients that I'm interacting with. I think another thing is, and this is kind of personal to just like my drive home, but I have part of my drive that I'm driving one direction, and then another part of my drive where for the rest of it, I'm driving a different direction. And so, I have made up for myself, just like I am willing to rant, I'm willing to think about, I'm willing to, I guess just like hold space for whatever my workday looked like as I was driving west. But the minute I start driving north, like that's whenever I'm really trying to like refocus myself into integrating into my home and being with my family. So kind of just even setting like some mental markers for myself to not, like Kellie said, bring work home with me. I think it's a really easy thing to do in this sort of field. Particularly because people who are drawn to this field, I think generally have big hearts and they want to be able to help other people. And part of doing that, means offering your energy and just like your space to other people in a lot of ways, but being able to, at the end of the day, like claim that back for myself, I think has really been important to me. I also have been able to find some things that are motivating to me, just being able to like find some movement after work. Since I've been in this position for, like I said, about a year and a half now, I have joined a volleyball team. So that's something that I look forward to every week, is just being able to, kind of like goof off, get some energy out, hit the ball really hard, and just like process some of those things that I might have, kind of had bent up or like pent up throughout the week. My wife is also actually a therapist, so she also kind of understands a lot of just how draining the workday can be. And so I think also finding people who understand just what your day might look like, or just being able to say like, hey, I am going to need you to maybe make dinner as opposed to me making dinner tonight, and really just like asking for those things that I'm needing. I would say during my workday, kind of like Kellie was saying, I do utilize like my managers and supervisors on that supervision call that I have for my licensure. It's actually not someone who I'm working with directly in any way, which is very helpful, because a lot of the times the things I'm frustrated about at work can be my managers, right? So having like another place to kind of funnel that energy, or just like funnel some of those frustrations towards, has been helpful. I would say the team that I work as a part of on our adolescent unit has also been pretty available whenever it comes to just like higher stress situations, or, having people who are making disclosures that are, maybe a little bit heavier. or might be just like a little bit more triggering is something that I find really useful. And then I think obviously an ideal world, like we wouldn't experience burnout in different spaces of work, but I think that's something that is very common and makes a lot of sense in the field of social work and the field of just like mental health care. So I will also kind of add, I think something that I really loved about social work, just kind of going into the field, is that you do have so many different directions to pivot. So, if I am no longer at a place where I'm able to work in this inpatient setting, I could very easily come up with a dozen other places that I would be able to work, whether that is, in like I mentioned before, like in some sort of like legislation or just like law or like even policy, thinking about like education, working with like homeless individuals. There's lots of different things that you can do in the field of social work. And I think it's really helpful just to be able to have something else that you might be able to turn towards if the work that you're doing really burns you out. Just to be able to kind of have that movement within your career, I think is probably important for a lot of people in this field.
Can I just reiterate, Sarah, something that Miranda, both of you said, but taking care of yourself first and foremost is the most important piece of preventing burnout. You can't pour from an empty cup. I say it all the time. What fills your cup? What fills your cup? And it can't necessarily, it might not be the same thing every day. I do something similar to Miranda. I like crank some music and just belt it out and just let it go. But yeah, it's how do you take care of yourself first and foremost? And I think, and this may be an overgeneralization, but I think a lot of the individuals who work in mental health, who work in behavioral health, have that lived experience of, I went through something, I did a lot of work on myself, and now I want to help other people get to the point that, I am, or that, these other people are at, that we can kind of continue to find that space to protect ourselves and to protect our own peace so that we're able to keep giving to those around us. So that's just my plug for always, reach out to people if you need help and find ways to kind of get access, because there's services out there, and we're all very invested in making sure that everyone has that self-care as well.
Thank you so much for saying that. And I really appreciate just all the specific tactics that you all have shared, because some of those, like Miranda talking about, what direction you're driving in your car, that's the first time I've heard that. And maybe for others on the call, I feel like there's, things that we can learn from you all too as well. So thank you all for sharing. I'm going to combine it's a two-parter to ask you all. So kind of on two different sides of the spectrum, what are your biggest challenges in your current job? And then on the flip side, what are your favorite parts about your job? Kellie, do you want to kick us off this time? We'll give Audrey an extra minute or a couple minutes to think about it. Okay.
Sure. It's interesting because I think Audrey already touched on this. I think probably one of the biggest challenges in general in mental health is just access. And so as much as I can give to a patient in that moment, there's always this need for follow-up care. And when that follow-up care doesn't have that immediate access, or the access in which is probably clinically indicated, you really have to navigate the different systems to be able to support a member. And so I think just in general, access to care can be the biggest challenge. What I like most about my job, I would say really meeting people at their lowest and being able to provide that support to get them past that place. It's a thankless job in the sense of I don't continue to work with this member. I'm supporting them right then, and then they're moving on to their treatment. And so, I really do enjoy meeting them again where they're at, helping them work towards that or past that crisis. And in addition to, I get exposed to so much in my job. Like I'm working with children, I'm working with adults, I'm working with parents to help support them. How do they manage the behaviors of these children? So I really am exposed to and continue to grow and learn with each one of these patients that I'm working with.
I'm happy to jump in next. I think the most challenging part of my job, I would say there's a couple of different things, but I would say the first thing that comes to mind for me, unfortunately, is working with my management. So in the time that I've worked here, I have had quite a bit of turnover of people in our administration, and it has kind of caused just some challenges as far as like having any sort of like continued leadership or just like continued goals that we're working towards as a hospital. I have been told that we've been working as like almost in some sort of like crisis response for a while, which is like not ideal. Obviously, like being a newer clinician and starting a career, I think that's like one of the last things that you want to hear is just that like the people who are supposed to be overseeing programs and overseeing the care that you're providing like don't really have it together right now. And so that's something that I think continues to be a challenge for me, just as far as having maybe some changes to expectations or just like changes to communication and just like what that looks like has been like a pretty frustrating thing, I think, for me to tolerate. I think another thing, like on a more like day-to-day basis that is challenging for me, specifically with working with adolescents, is maybe acknowledging that the environments that they come from and just like the support that they might not have at home isn't really something that we can always do a whole lot in terms of just like figuring out what their treatment at the hospital and just like how quick admissions are, I guess, on the inpatient side. So typically we see patients for maybe up to a week, and knowing that they don't always have the most support or just like the best environment that they're returning to, or sometimes just dealing with their parents can honestly be really challenging. So I will say that that's probably one of the more difficult parts about my job is I guess just acknowledging like life as a teenager is really challenging for reasons that are outside of teenagers' controls. And I think just being able to work with somebody on, this isn't something that you can change. This is something that we might have to just figure out how to cope with. I think is a pretty challenging or like, challenging part of my job. I would say on the flip side, something that I enjoy most about my job is just being able to like build connections with patients. I have had many experiences with patients who are pretty untrusting of different adults, pretty untrusting of different providers for different reasons. And so being able to build that trust, I think, is really important to me. It's something that I value a lot within my job.
And I can go from a more like macro level view. I think one of the most challenging or frustrating parts of my job is knowing that as hard as we try, we can't help everyone every second of every day because we just don't have enough staff. We don't have enough access. We don't have enough time in the day. So that's a very frustrating thing for me to see the numbers of, we're getting all of these referrals. Well, because I have much more, I have a data lens into it of, they're sending me all this information that says we have, let's say 50, referrals this morning. Okay. Well, I can't see 50, I can't have my clinicians see 50 patients today. They're already seeing patients who are already part of the system. They're already seeing patients who they are, already admitted. And so that is very frustrating to know that, we are doing our very best and there is still a need. So that piece is very frustrating. And on the flip side of that, my frustration is also, how do I protect my team? Because I could have 50 clinicians working 24/7 and still not meet that need. And so how do I make sure that my team internally has the support they need to continue to provide really good care and to feel good about the care they're providing and to feel good about their jobs? And so that is also very frustrating when I feel like I'm trying to balance that like need of our patients and need of our staff, because those are not always things that are very easily sort of evened out. And how do I manage that? And how do I advocate for my team and for my patients at the same time? So that is something that's very challenging. What I love to see and what is really exciting to see, again, from like a data standpoint, high level standpoint, is when we really see trends in how our patients are getting better. So we look at, how well, like their depressive symptoms, for example, over a course of treatment, and we ask them these questions at various intervals. And when you really see that changing over time, and I can go back to that clinician or that team and say, your patients are so much better when you're done working with them. And you guys had that impact, and that is a really cool thing to see. So I think while, like Kellie mentioned, it can be a very thankless job in some ways because individual people may or may not, especially in crisis settings, especially, for example, in Miranda's setting, people don't always want to be there. They're not always there voluntarily. And that can be something where they're not super grateful for what you're able to do for them. They might just want to get out of there. They might be, very ill to the point where they don't really know what's going on. And so that side of it can be very thankless. And then you'll have people who are very acutely aware that they are ill and want help. And we have some really cool stories where, you kind of get that almost goosebumps hearing about how someone's life has turned around. And so I think it, again, is sort of this dichotomy of, you're going to have some very unhappy people all the time, and you're also going to have some people who really, truly could not be more grateful for what you do. And then you'll have the in-between where you can really just see kind of from a data standpoint, from a sort of their quality of life standpoint, that what you're doing is having an impact. So that's the piece that I really like to see, is kind of long-term overarching. Are our patients getting healthier? Are we keeping our patients from needing all of our crisis services over and over again because we're stabilizing them, things like that. So that's the piece that's really rewarding for me, to see that it's actually having a long-term impact on our patients' health.
Great. Thank you so much. My last question for you is going to be maybe a little bit of a speed round, because I want to save the last few minutes. At the end of the call, we're giving out a gift card. We have a drawing for a student in attendance, so I want to make sure we save a little time for that. But would love to hear very briefly from each of you, and whoever wants to jump in first, go ahead. What is one piece of advice you would give to a student, so thinking back to when you all were students, that might be interested in exploring or pursuing this career field, or the career field that each of you see yourselves individually in? Whoever wants to jump in first.
I can answer that question first. I think something that I touched on a little bit earlier was just like how unexpected your journey might be, and just like being able to kind of take it as it comes and be able to pivot whenever, different circumstances in your life are asking you to pivot. I think just being able to keep an open mind in terms of like what might be available to you, or what your interest might be, I think is a really important thing entering any field. Specifically about college, I would say just to be involved as much as you're able to, or just like whatever your capacity is. I think just knowing your campus, knowing what sort of resources are available would definitely serve anybody well.
I would second Miranda in, just being open about the different opportunities. Don't be afraid to take on challenges that might be unexpected or outside of the box, and continue to lean into the support network that is available to you. So that might be through school, obviously, like the counselors, the teachers, your your classmates. But as you grow professionally, your managers, your colleagues, you know, I'm a huge advocate for continued education. And so really leaning into the support, consulting with your colleagues, continuing to grow and develop, and never be afraid to ask questions. Okay, like there's oftentimes I'm like, did I do the right thing? Was this, you know, so continuing to lead with curiosity and, you know, be open to feedback that others might have.
Yes to all of those things. And then I will, my one sentence is take care of yourself as well. That is a big thing. I think we see a lot of high school and college age students who are really struggling themselves and yet still trying to help others. Please make sure you're taking care of yourself first and foremost, because you cannot pour from an empty cup.
Wonderful. Well, thank you all so much for your time today. I personally found it fascinating to hear from all of you. You all have such unique, you know, experiences, and just appreciate your transparency today and all that you shared. So thank you. And then I'm going to hand it over to Cindy, who's going to close us out.
Thank you so much. Once again, thank you, Miranda, Audrey, and Kelly. It was really wonderful to hear all of your insight, and especially to share your experience. We really honor that and want to thank you once again. For our students and scholars, if you want to pop an appreciation message or utilize the emojis to show some love to our panelists, please feel free. We also have an upcoming we've asked our questions, but we have an upcoming virtual insight panel as well. But before that, we like to invite you to complete our post-event survey. So you can either scan the QR code that's present on the screen, or we put the survey in the chat. We would really like to hear your feedback to look to improve for our future panels, which, speaking of, we'll be hosting a business and entrepreneurship virtual panel like this one on Wednesday, October 16th. So if you're interested, please look out for the post-event survey on that. And I know everyone's excited for the gift card drawing, so without further ado, I'm just going to stop the recording here. And then we have entered everyone's names, so let me add them here. And I will reshare my screen. Thanks everyone for your patience. And good luck. So we have a $25 gift card. It's virtual, and I'll be following up with our lucky winner after. Can I get a thumbs up, Sarah? Can you see the screen? Okay, perfect. So best of luck. If I had a drum, I would give y'all a drum roll. All right, it looks like Alondra, you are our winner. Alondra, I don't believe that I have your email. So if you can please pop that in the chat to ensure that I can contact you for your gift card. But once again, thank you all so much for attending, and we hope you have a wonderful rest of your day and of your week. Make sure to take care of yourselves and have a great rest of your day.
Bye, everyone.
Thanks,
Thank you so
guys.
much.
Bye. Alondra, it's whichever you prefer.
Congratulations on winning.
Yes. Alondra, if you don't mind sharing, thank you. Are you a DPS high school student, or are you a college student? Are you a scholar?
Yeah, I'm a college student.
Yay.
I'm a
Okay,
scholar,
perfect.
yeah.
What school do you go to, Alondra? I just want to make sure that you get credit for attending.
CU Denver.
Perfect. Okay. Well, thank you, Alondra. I have your email, so I'll be following up with you for your gift card, but thanks for joining us and congrats.
All right.
Yeah.
Thank
Have
you
a
so
good
much.
one. Bye.
Thank you. Bye.
Thank you, Sarah.
Thank you. That was really good.
Great work. Yeah, it was a really great turnout. We had, I think, Alondra, and there was another, her name was Erica, who I think attempted to RSVP, but they just
saw the message and joined on, so I didn't get their emails. That's why I was asking her.
Oh, they came in later, or like they joined.
Mm-hmm.
Yeah. Okay.
No,
cool.
they came in like right on time. I just
Right,
they
but I mean,
they weren't like
they didn't-
pre-registrants.
Yeah. Okay.
Yeah. So we just want to make sure
That's
we
great.
get their info. But yeah. Well, thank you so much.
Thank you.
Are you
Alright.
still gonna be online for the day, or?
Yeah, I
Just
have a couple
taking
more.
it.
I have more meetings this afternoon, so I have a little break.
Okay.
in.
Okay. Well, just let me know if you need
Thank
anything.
you. I appreciate it.
Great.
Thank you for all your help,
course.
Cindy.
Happy to. I'll talk to you soon.
Okay. All right. Bye.
Bye.